We will go ahead and get started. So today we're going to be talking about seeking safety. We have Gloria Osborne with us. Before we get into the presentation, just we'll start off with a little disclaimer. The views and opinions and policies that you may hear today are not necessarily the views of DHCS or CARS. For those of you joining us for the first time, there may be some folks who have not attended a CARE TA Center a webinar. We are the Crisis and Recovery Enhancement TA Center. We provide comprehensive array of training and technical assistance services to California's Mental Health Services Act funded stakeholders and partners. It's a collaborative effort between the Center for Applied Research Solutions and some partners from the community. We work with Recovery International, NAMI California, C4, Research and Action Center at Impact Justice, and also Stanford Sierra Youth and Families. With the extensive subject matter expertise of our partners, the CARE TA Center provides tiered training and technical assistance to 3 audiences. We break that up into universal TA, which is state level mental health provider audience, targeted TA, so California's counties, and intensive TA to individual counties and small groups. Some examples, the TA include innovative and evidence-based program materials. You'll see on here, there's some examples, discussion hours. We have a newsletter that goes out, webinars like what we're doing today. So all these services are free of cost, and we encourage you to reach out. On our website, there's a training and technical assistance tab. You can request things that we may be able to assist with. Let's meet our trainer. Gloria Osborne, LCSW, is a bilingual and bicultural Spanish-speaking mental health clinician with over 10 years experience providing direct care in both inpatient and outpatient mental health settings. She earned her Bachelor's of Arts in Psychology and Spanish, from Loyola Marymount University, and earned a master's degree in social work from the University of Southern California. Fight on. She currently works as a psychiatric social worker for Kaiser Permanente, while also running a virtual private practice called Glow in Therapy. Before joining Kaiser and starting a private practice, she worked many years in directly operated and also county contracted facilities within LA County. She's certified in a variety of evidence-based practices, including seeking safety, trauma-focused CBT, MAP, IPT, CPP, and national certification in cognitive behavioral therapy from the Academy of Cognitive Therapy. Her professional interests include destigmatizing mental health care, working with the Latinx community, relationships, depression, anxiety, trauma, life transitions, and also substance use recovery. We are very excited to offer you this presentation of Seeking Safety by Gloria Osborne, and I will turn it over to her.
All right. Thank you so much, Tiara, for the wonderful introduction. I want to welcome everyone for joining us this lovely Wednesday to learn a little bit more about utilizing evidence-based practices with populations targeting substance use and trauma recovery. I want to provide just an agenda, an overview of what we'll be covering today. So today's topic is seeking safety. We'll do a brief review of PTSD and substance use disorders. I'll be going over a description and goals of seeking safety, talking about seeking safety topics and interventions. And then last but not least, we'll be examining some essential topics for today. There's some learning objectives. I hope that by the end of this presentation, you'll be able to have learned some basic principles about seeking safety, understanding the value and application of evidence-based practice, and becoming more effective with populations challenged with trauma and/or substance use concerns. All right, so today's topic, as I mentioned, we're going to be doing an overview of seeking safety. So what is seeking safety? It's an evidence-based, integrated, present-focused counseling model to help people attain safety from trauma and/or substance use. So the primary goal of this evidence-based practice is establishing safety. It can be conducted in both individual sessions as well as group sessions. You don't need to be officially trained or certified in order to provide seeking safety with your population. And it can be conducted over any number of sessions, whether it's one session you get with the client or if you have them for a longer 10 to 15 sessions, you can coordinate with the client on how you're going to treatment plan regarding seeking safety. Okay, so just a little background about what seeking safety is. So it was developed by Lisa Navajits, a PhD. It started off as a study in 1993, and then it was officially published as an evidence-based practice in 2002. It was the first treatment model designed where they integrate both treating substance use and or trauma at the same time. So what they learned in studying, the different types of interventions that were available is that there were a lot of practices focused on just substance use and just trauma. There was nothing that was combining the two. So that was the motivation for developing seeking safety, is really developing an evidence-based practice where you can target both topics at the same time. It's a highly structured yet flexible model, so it's really adaptable to meet the patient's needs. And the primary focus, again, is just to really enhance safety. You're going to really be focusing on teaching the client how to establish those safe coping skills. And there's a huge focus on potential rather than pathology. A lot of the clients that come to us that are dealing with substance use and trauma, might be feeling a certain way about themselves. They might be judging themselves. They might feel stigmatized. So this is a model that's really going to instill the patient's potential. So really helping them overcome the challenges that they're walking in the door with. I want to provide you with an overview of what seeking safety sessions look like. Every session is going to essentially look the same in terms of structure. While seeking safety is very structured, it is adaptable to meet the client's needs. So you're really going to follow the structure, but kind of go with the flow, get a feel for how things are going with the client, and adapt as needed. But you always start with the check-in. So at check-in, the same 5 questions are going to be asked at the beginning of every question. Why this is done, it's really just as a temperature check, just to kind of get a feel for, what the client is dealing with, how they might be doing, what have they done since the last session, and so on and so forth. I'll be sharing what those 5 questions are in the next slide. After you do a check-in, you're going to introduce a quote. This quote that you share with the client is typically connected to whatever topic it is that you're going over. And it really helps to emotionally engage the patient in the session. You review the quote, have the client say the quote, and then you ask them a primary question: what is the main point of the quote? And then really help the client to tie in why that quote is related to the treatment topic, as well as why that might be applicable to their own lives. Within that seeking safety topic, you're going to get a list of handouts. So if you don't already know, seeking safety is a very manualized evidence-based practice. So it is going to require you to purchase a manual. Within that manual, depending on which one of the 25 treatment topics you're focused on, you're going to get a series of handouts. Those handouts are going to give you the main topics or the main points of the topic that you're going over. You're going to get handouts as a clinician on how to guide the session and prepare for the session, as well as handouts to provide to the patient during the session. So it's a lot of handouts. But either way, I hope that by the end of today's session, you'll feel a little bit more encouraged on how to integrate those handouts in the sessions. You're really going to be focused on having a discussion and reflection session with the client, really tying back that topic to their life, helping them to identify new strategies on how to approach that particular topic in their life. It's really great to integrate role plays so that they get a feel for how to implement some of these changes. And then depending on what the treatment topic is, you're going to get some in-session practice exercises where you as the clinician can practice with the client and really have them get a feel for what it might feel like to implement those new changes. And last but not least, there is a checkout where the same 3 questions are asked at the end of every session. And it's really to just reinforce the patient's progress and also provide feedback to the therapist about how that session is going. So pretty standard. There's a check-in, a quote, you got some handouts, a discussion and reflection, and then you got a checkout. So with that said, I really wanted you guys to get a feel for what the check-in might feel like. So these are the 5 questions that are going to be presented at the beginning of every session with the client. So I want to encourage you guys to share in the chat box that first question. How are you feeling today? I know these are some pretty interesting times that we're going through. So if you feel inclined to just share one word on how you might be feeling. Overwhelmed. I have some days where I feel overwhelmed too. I'm excited to be here today and share a little bit about seeking safety with you guys. But thank you. Anybody else? Stressed, excited, tired, hopeful, interested, drained? Okay. All right. So we got excited, calm. Okay. Lots of different feelings, right? So this is the first question that you're really gonna, the client walks in the door, sits down, you're gonna do that temperature check. How are you feeling? The next question is, what good coping have you done? So if you guys can share in the chat, what good coping have you done during this pandemic? I'd love to get some new, exciting types of self-care. I know for me, something that I do every day is meditate. I see somebody else is meditating, so that's wonderful. Meditation is so important. Pour painting. I don't know what that is. Okay, baking, puzzles, kickboxing. Awesome. Walking on the beach. Cool. Asking myself what I'm grateful for every day. Great. Okay. So again, right here with this question, you're really targeting, what is the client doing for good coping? For the remainder of the questions here, given that this is a professional setting, I don't expect you to share with me about your substance use or unsafe behavior, but you are going to be checking with the client at every session. Has there been any use of substances, or are there any unsafe behaviors that the client is engaging in outside of sessions? This is really going to target how safe are they keeping themselves in between sessions. Question number 4 is, did you complete your commitment? So at the end of every session, you're going to encourage the client to commit to something new to do over the following week, or however much in between sessions you get for clients. But either way, you're really going to be encouraging them to commit to something new for themselves to do. So at the following session, you check in with them. Did you get a chance to complete your commitment? And number 5 is the community resource update. So a part of seeking safety is really focusing on case management. Most of the clients that come to us, I know when I was working at LA County, have very complicated systems that they're dealing with outside of just the mental health system. Some people are dealing with probation, some people are dealing with DPSS and trying to get their benefits taken care of. Some people are in school, some people have job qualifications that they need to be following up on. So this is that question where you're assessing with the client, how are they addressing their connections with the other systems outside of their lives in between sessions? And this gives you, the clinician, an opportunity to assist the client should they might be having a concern or a struggle in trying to connect with the resource. You can assist them in walking through that connection. So as you remember, seeking safety, you always start with the check-in, and next we have a quote. So the quote that I've chosen for today, while you don't get to choose the quotes for the topic that you'll be using in seeking safety, it's already given to you. I thought it'd be fun to pick a quote that would relate to the topic that we're going over today. So the quote that I've chosen is, "Safety isn't expensive, it's priceless." So thinking about that quote, what do you guys think the main point of that quote is? You can go ahead and share with us in the chat. What might that quote be trying to get at? Safety isn't expensive, it's priceless. You can't put a value on safety. Yes. There is no cost to feeling safe, as it's invaluable. Safety is invaluable. We're worth it. That shouldn't be something to put away. Yes. You can't put a price on safety. Yes, exactly. Safety is key in making changes. Without safety, you have nothing. It doesn't take a lot for someone to practice. You can't put a label on what it's worth, and safety is essential. So again, we're tying it back to safety for the client, really showing them that safety isn't the thing that you want to put up in the back of the closet or you want to sweep under the rug. It's the thing that you want to keep at the forefront. You really want to prioritize safety because without safety, it's going to be hard to make some moves. Okay, so why safety? I really want to take it back to Psychology 101 and go over Maslow's hierarchy of needs. So we know, based off of Maslow's hierarchy of needs, that people are motivated by 5 categories of needs. So if we look at them, we have physiological needs, safety, belongingness, esteem, and self-actualization. And safety is right there, number 2. It's considered one of our basic needs. So if you're really trying to help a client who comes in get, to the top of the pyramid, that self-actualization, they have a job they want to accomplish, they want to go to school, or they want to get a home, or they want to get their children back, whatever your client might be dealing with, it's going to be hard to move up that ladder of, the hierarchy of needs if safety isn't established. So again, this is the primary focus of seeking safety, is teaching the client how to prioritize safety and what safety might look like for them in their lives. So before we get into it, I'd like to ask you guys a question. I want to know, based off of the people that are here today, if do you work with individuals challenged with A, substance use, B, trauma, C, substance use and trauma, or D, none of the above? All right. So based off of the individuals who answered in the poll question, we have 82% of you guys are seeing people who have substance use and trauma. Yes, most of the clients that come to us are dealing with both issues. There are some people who also have clients who just have trauma. Only 2% of you only have substance use, and 6% none of the above. Okay, awesome. So I really wanted to just get a feel for how many of you guys are seeing the population where we have both of these challenges going on at the same time. So, a majority of us. I want to do an overview about what substance use disorder is. And I want to just highlight that although we're going to be going over what substance use disorder is, in order to use seeking safety, the client doesn't have to necessarily meet criteria for substance use disorder. But this is something as a clinician that you're going to constantly be assessing. At what point, if at any point, does the client meet criteria? So we know that the DSM-5 recognizes substance use related disorders resulting from the use of 10 separate classes of drugs. We have alcohol, caffeine, cannabis, hallucinogens, inhalants, opioids, sedatives, hypnotics, anxiolytics, stimulants, tobacco, and or unknown substances. So basically any kind of substances that are causing any kind of mind altering substance or alcohol. So the DSM categorizes different criteria on what would classify a client who might have this substance use disorder. So we're looking at clients who are taking the substance in larger amounts or longer than they're meaning to. So they might find themselves in a situation where one week it's just, I only have to have 1 glass of wine and I'm okay. And then over time, it turns into 2 bottles of wine. That for you as a clinician, you're going to constantly be assessing for that. As you can see in the check-in, you're going to be asking about substance use. So that's something to just keep in the back of your mind. At what point, if at all, is the client increasing their use of substances? The client might express to you, I want to cut down or stop using the substances, but I'm not able to, or I don't know how to manage, right? So just really continuing to assess with the client, okay, what is their relationship like with the substance that they might be using in their lives? They might be spending a lot of time getting, using, or recovering from the use of substance, cravings and urges to use the substance, not managing to do what they used to do at work, home, or school because of substance use, continuing to use even when it causes problems in relationships, giving up on important occupational, social, or recreational activities because of the substance use. Again, you're going to constantly really be assessing what is the relationship that this client has with the substance and how much is it impairing their everyday functioning or what they have going on in their lives. Or, what is the client saying to you? Like if they're coming in and they're saying, every time I drink or every time I use a substance, I find myself in this dangerous situation, then, you might want to be assessing, okay, how relevant is this? Is this continued use of substance in your life? How does this relate to safety? Right. And then continuing to use, even though there might be a physical or psychological problem, needing more of the substance to get more of the effect, needing more of the substance to get the effect that you want, or development of withdrawal symptoms, which can be relieved by taking more of the substance. So again, you're just really assessing how relevant the substance is in the client's life. So aside from substance use, we're also going to be looking at trauma. So we know the DSM captures trauma with post-traumatic stress disorder. Just like the client doesn't have to meet criteria for substance use disorder in order to use Seeking Safety, the client also doesn't have to meet full criteria for PTSD in order to utilize Seeking Safety in relation to trauma. I did just want to provide a brief overview of what PTSD is, as most of us are dealing with clients who do experience trauma. So we know it's a psychiatric disorder that's associated with experiences of trauma. Trauma could be a natural disaster, a serious accident, a terrorist attack, war, combat, rape, or having been threatened with death, sexual violence, or serious injury. Something important to point out about trauma is it can be a direct exposure to trauma, or it can be an indirect exposure, and the person can still be suffering from any kind of trauma symptoms. So they could just hear about it or be in close proximity to something that happened, but maybe not directly experiencing it to be experiencing trauma. There are 4 different categories of PTSD symptoms. We have intrusion, avoidance, alteration in cognition and mood, and alteration in arousal and reactivity. The symptoms must be present for at least a month and cause significant distress or impairment in an individual's daily functioning. So we're looking at those clients who come in and tell us, yes, I've experienced a trauma, and then you're going to be assessing how prevalent are the symptoms that they're dealing with, whether they're nightmares or flashbacks or hypervigilance or anything like that, outbursts. Just as a clinician, you're constantly assessing for that. So what causes substance use and PTSD? So what the research says is we know that those who are diagnosed with PTSD are 3 times more likely to use substances. Substance use and addiction is commonly connected to co-occurring disorders like PTSD, depression, and anxiety. As we saw with the poll question, most of us are dealing with clients who are dealing with both substance use and PTSD. People seeking treatment for PTSD are 14 times more likely to also be diagnosed with a substance use disorder. And people with PTSD often use substances to self-medicate. So we know that there is a lot of overlap with both of these challenges in the mental health community. All right, I wanted to give you guys some statistics to go over the prevalence of substance use and PTSD. So 19.7 million American adults aged 12 and older experienced a substance use disorder in 2017. So it's a pretty big number. And then 7 to 8% of the population will have PTSD at some point in their lives. In 2017, 8.5 million American adults experienced both a mental health disorder and a substance use disorder or a co-occurring disorder. Dual diagnosis of PTSD and substance use is very common. 12 to 34% of patients in treatment for substance use also have PTSD. And then we know for women that the prevalence is actually higher. 30 to 59% of those women in treatment for substance use are also experiencing PTSD. And then people with PTSD and substance use are vulnerable to repeated trauma. We know that using substances can really impair judgment, impair cognition, allow people to put themselves in vulnerable situations, therefore making it more easy to be in a situation where you might be exposed to a trauma. So they kind of go hand in hand. Like some people are self-medicating because they have trauma, and then some people who are using substances are putting themselves in situations where they might be exposed to trauma. Some cultural considerations. So according to a study conducted by SAMHSA in 2017, the following ethnicity race breakdowns were found in individuals with substance use disorders. So the prevalence of substance use disorder by ethnicity and race, if you look at the pie chart, we can see that 12.8% is American Indian and Native Americans, 7.7% is Caucasian, 6.8% is African American, 6.6% is Hispanics, 4.6% is Native Hawaiians and Pacific Islanders, and 3.8% is Asian Americans. So what this is really showing us is that substance use is found in any ethnicity and any race. It does not discriminate. So any one of our clients could be coming from any one of these ethnicity breakdowns. So there's some cultural considerations regarding dual diagnosis that I also want you guys to consider. When it comes to gender, and when we're looking at trauma specifically, the research shows that men tend to, in relation to trauma, be in situations where there's crime victimization or war trauma, versus women who tend to have higher rates of childhood physical and or sexual abuse. There are some vulnerable populations with higher rates. Some of these populations include combat veterans, survivors of domestic violence, people experiencing homelessness, and the adolescent population. I know from working at the county myself, any one of us are going to be dealing with any one of these clients coming from one of these populations. So chances are it's really important that we're assessing, how prevalent is substance use, or how prevalent is trauma in the client's life. So we already know, coming in the door, research showing that these populations tend to be a lot more vulnerable to both. So before we jump into seeking safety, I want to learn a little bit more about what you guys may or may not know about it. So this is another one of those poll questions. All right, so the results are a little bit of everything. Looks like most people, sounds familiar, but I don't use it. And then I use it less than 50% of the time. I had not heard of it before this training, and then there's a smaller percentage of us that use it all of the time. Okay, so I hope that in the next couple slides, learning a little bit more about seeking safety will inspire you to perhaps start to implement these practices with your clients. All right, so there are some goals for seeking safety. So as I mentioned, the number one primary goal is safety. Our focus here is helping patients attain safety in relationships, thinking, behavior, and emotions. Chances are, if the client is using substances and or has been exposed to trauma, safety is something that they may not prioritize or may not even really know how to begin to implement in their lives. So the goal here is to really be assessing for safety and how to teach the client how to prioritize safety in their lives. As I mentioned earlier, it's an integrated treatment. We're working on both trauma and substance use at the same time. And there's a focus on the impact on current life. So we're not going to be diving back deep on childhood trauma and really working through that. We're going to acknowledge, like, yes, there's trauma here, but how is it impacting you today? Yes, there's substance use here. How is it impacting you today, and what can we do about it? Number three is there's a focus on ideals. So we're counteracting the loss of ideals in both trauma and substance use. Given the experiences that our clients might go through if they've been exposed to trauma and or substance use, there might be a loss of some ideals. So seeking safety, the topic breakdowns are going to reestablish those ideals in their lives and show them, regardless of having been exposed to these things, you are able to recreate a relationship with certain ideals. There's going to be 4 content areas that we focus on: cognitive, behavioral, interpersonal, which deals with relationships, and that case management piece, assessing the way that the client is integrating with the systems that they have to deal with in their lives. And then number 5 is that there's an attention to the clinician's process, really the clinician's emotional responses to what comes up, assessing for self-care, and that therapeutic alliance. How well are you and the client aligned in the goals for treatment? So who can benefit from seeking safety? People from any gender, adults or adolescents. We're looking at any length of treatment, short-term versus long-term, any level of care, whether it's outpatient, inpatient, residential, group homes, any type of trauma, any type of substance use that they might have. And again, there's a focus on the various populations that Seeking Safety has been really beneficial with, including those experiencing homelessness, those dealing with the criminal justice system, domestic violence, severe mental illness, veterans in the military, and many others. So Seeking Safety is very, very useful with many different populations. So I wanted to give you guys a breakdown of the Seeking Safety topics. So there are 25 total Seeking Safety topics. And again, like it focuses on the cognitive, the behavioral, the interpersonal, and the case management. I really wanted to provide you guys with this information because this is going to really help you when you're going to be treatment planning with the client. You might have a client who wants to focus more on making behavioral changes. Well, then here's your kind of cheat sheet that you can look back on. What are those Seeking Safety topics that really focus on behavioral changes? Or maybe a client really wants to focus on improving their relationship. So you're going to pick a topic that's focused on it, more focused on interpersonal. There are a couple of Seeking Safety topics that combine all four, which include the very second topic, which is safety, the life choices game, and termination. And then there's only one that really covers case management as a whole, because if you remember at the beginning, when you're doing the check-in, you're constantly assessing what's a community resource update. So there's a little bit of case management in every session that you're doing with the client. So again, well-rounded, lots of different topics. There's a topic for everybody, depending on what the client's focus is and what they want to improve on. Okay, some considerations for treatment planning. So when you are, you get that client, you're sitting down with the client, you're going to treatment plan with them. I want to just remind you that this is a treatment plan, evidence-based practice that is really strengths-based and focused on empowerment of the client. So although that client might be dealing with lots of different things, this is their chance to recognize like what their strengths are, what they're coming in the door with, and how you can really highlight that and tie it back to their lives depending on whatever topic it is that you're going through with the client. So really just highlighting the client does have the capacity to work through whatever it is that they might be dealing with based off of the information that you're going to give them. You want to take into consideration how much time will you have with the client. So some of us might only see a client for one session. Some of us might see them for 10. Really sitting down and assessing with the client, okay, how much time are we going to have together and what's the primary focus here? You're going to want to check in with the client. What are the patient's goals for treatment? I know I was very guilty at the beginning. I'd want to come in with my own agenda. Okay, this is how I think the client is going to benefit from certain things, but we really have to remember the patient is in the driver's seat here. So really checking in with them. What are their goals for treatment? What are they hoping to get out of this? And then in the Seeking Safety manual, there is a list of all 25 treatment topics. I would highly recommend just sitting with the client and showing them the treatment topics and asking them, which ones do you want to cover? Which ones do you think would be great? The really neat thing about Seeking Safety is although there's 25 treatment topics and they're in a certain order in the manual, there is no right or wrong. You can start at the beginning, you can start at the end. It really just depends on where the client is and what it is that they're hoping to get out of treatment. And then last but not least, you really want to work on how you can collaboratively work together to achieve those identified goals. So as stated before, the checkout is really going to be assessing, how well is the session going? Is this information valuable to you? Are we working well together? If not, then it provides an opportunity to have those discussions where you can make adjustments as needed. Now getting into the intervention piece. Let's say you have that manual, you have the client, you got to do the check-in, the quote, the handouts, facilitate that reflection discussion, do the checkout. You might be asking yourself, how am I going to utilize this material in clinical sessions? For those of us that are familiar with seeking safety, it can be very overwhelming. It's a lot of information. Even for those of us who have the degree, who have been in school, who have recognition of some of these things, it can be a lot. I have some tips here that I'd like to just recommend to you to just remember, like outside of all of that information, like the client is coming in because they're looking at you as the expert, but they are the expert on their lives. So you really want to take that information and make it interactive. How can you engage the client in a discussion where this information can be applicable to them in their lives? You really want to give them a chance to relate to the information that's provided. Let them tell you what they think about healthy relationships. Let them tell you what they think about safety or what it might mean to have experienced trauma and want to be in a position to take their power back. Then you really want to engage the client in that reflection process. There's a huge focus here on really allowing the client to reflect on this material. And I want you guys to not feel so rushed with these handouts because it can be a lot. Some of the topics can have like 5 to 6 handouts. There's no right or wrong in how you decide to utilize those handouts. Maybe for one of those topics, you choose one handout and make that session just all about that one handout. What is going to be more valuable to the client here is how they can relate to that information. So we're looking at the quality of that session versus the quantity. We definitely don't want to bombard them with too much information. You want to provide the client with an opportunity to explore their topic or explore their thoughts on that particular topic and how they might change their perspective on that topic. So while they might come in and let's say if we're talking about healthy relationships, they might have an idea that healthy relationships are just not possible. I can't trust people today. The goal here with seeking safety is switching their perspective, getting them to consider, could I maybe one day have a healthy relationship in my life? That's just an example for one of the topics on how you might focus on changing a client's perspective. Okay, so here's some reflection questions regardless of what treatment topic you're dealing with the client that I myself in utilizing this evidence-based treatment model and over the 10 years that I have experience in working with clients, these are the reflection questions that I have found to be most effective in terms of getting the client to open up and talk about what's coming up for them. So really bringing it back and asking them, what feelings are coming up as we go over this material? Like I mentioned earlier, for some clients might not even know what boundaries are. Maybe they've never heard of what boundaries are in relationships prior to you bringing it up as a topic. So just really doing that temperature check with them. What's coming up for you as we go over this? Next question is, how might you approach this situation, so whatever situation it might be, differently in the future? One of the topics is healthy relationships. I know I keep going back to that one. That's a pretty easy one to remember for me. How might you approach establishing a healthy relationship differently in the future? Given the fact that our clients are exposed to trauma and or substance use, they might not have the best relationships in their lives. They might not know how to establish those boundaries or know how to ground themselves and be aware of their own feelings. So these questions are really going to encourage the client to do a check-in with themselves, ask themselves, like, how am I feeling? What is coming up for me? How might I approach this differently? You want to ask them at the end, what is something new you're walking away with? This is a really great way to just make sure that the client isn't being overwhelmed with the information that you're giving them, because they might just shake their head like, yes, I understand, but actually taking the time to say, hey, like, what's something new you're walking away with here? And then it also gives the client an opportunity to say, hey, I actually knew about this before we talked about this. So again, really just assessing the strengths that the client might be walking in with. And then last but not least, we're looking at, how does this promote safety in your life? So when in doubt, using seeking safety, always tie it back to safety. Really just, encouraging the client to assess, how am I implementing safety on the day-to-day in my life? All right, so I thought it might be helpful to go over 3 different seeking safety topics that I have found in my own clinical experience to be really beneficial with clients, no matter how much time you have with them. So safety is that topic that's going to cover all four of the topics that Seeking Safety covers. So that's cognitive, behavioral, interpersonal, and case management. Then we're going to talk about detaching from emotional pain, which is also known as grounding, which is going to target a behavioral change for a client. And then we're going to talk about boundaries, which is going to focus on the interpersonal aspect of a client's life. All right, so the first topic here is safety. So what does this consist of? So when you flip, you have your Seeking Safety manual, you flip to the safety portion. You might be asking yourself, okay, what might be the purpose of this topic? The purpose of this topic is to just really encourage the client to recognize their need to stay safe and to remind them that they can do so by learning safe coping skills and practicing them regularly. So you're going to get some handouts that are going to help the client in session review unsafe versus safe coping. They're also going to have an opportunity to review stages of healing from substance use and trauma. Given that they're being exposed to these things, they might not be engaging in safe coping or know how to do safe coping at all. So really just giving them that opportunity, there is a chance to recover from this, even though you might have been exposed to these things in your life. You're going to assist the client to identify what safety means to them. And then there's going to be a list of 85 different coping skills. So already, as you can imagine, a client comes into your office dealing with trauma and substance use, and then you just give them a handout with 85 coping skills. I don't know about you, but if that was me, I'd be really overwhelmed and I wouldn't want to look at that. It's a lot for me to look at. But again, this is just something to keep in mind. There's lots of different ways to stay safe, but it's all about how you utilize this material and make it more efficient for the client. So why should the client prioritize this topic? Overall, life is going to happen. It's so important to have safe ways of coping no matter what. The client might be coming to therapy or might be coming to case management with you because their substance use is getting in the way of them keeping up with their job, or their trauma symptoms are keeping them from getting good sleep at night. So therefore they're late to work or late to class or whatever it might be. So just really encouraging them, regardless of what your experiences have been, there are ways for you to learn to cope safely. It really teaches the patient to prioritize taking good care of themselves. A lot of our clients don't know how to take good care of themselves. So this is an opportunity for you to have that discussion on what it means to take good care of themselves, and then also how to start taking good care of themselves. And there's that emphasis on the ability to recover from substance use and trauma. Again, so we're really establishing that strengths-based perspective. You can recover from this no matter what. So some interventions, if you're going to be utilizing this topic with a client, here's some interventions that I really want you guys to, hopefully you would find helpful. These are based off of my own experiences with my own clients over the years, both in inpatient and outpatient settings. But I have sat with the client and I've had them reflect on their unsafe and safe experiences. This will really give you the opportunity as a clinician to see what the client defines as safe in their life. They might not have a good perspective, or they may have a good perspective on what safety means. So either way, it provides an opportunity to really educate the client on why safety is important. You might want to bring it back to that review of the Maslow hierarchy of needs and really talking about why safety is important. In order for you to get that job, we have to make sure that you're staying safe every day, really allowing them to get a visual for why safety is important for them in their life. The next one talks about identifying which safe coping skills they currently practice. So something that I have done with clients, I believe it's about 5 handouts that breaks down those 85 coping skills. What I have done is broken down those 5 handouts into 3 separate sessions. So we go over 2 handouts in one session, 2 handouts the next, and 1 handout in the last. If you don't have 3 sessions with the client to go over safe coping skills, that's okay. I would say, 2 is probably a good number to start with because it's maybe, it's a lot for them to go over. But something that I've done to make this interactive with the client is I've had two different highlighters. I've had a yellow highlighter, a blue highlighter, and I've said, hey, we're going to go over safe coping skills today. I'm going to give you this yellow highlighter. The first thing I want you to do is check off the ones that you're already doing. Because I want my client to see they're already implementing some things that they might not even recognize as safe coping skills. They're already doing them in their life. So I'm having them check that off so they can get a visual. Hey, I'm actually doing quite a lot in my life when it comes to safety. Then the next thing I'm going to do with that blue highlighter is I'm going to say, now I want you to circle ones that you've thought about and would maybe like to try. Maybe you'd like to implement or learn how to implement that new safe coping skill. And then what it gives you is an idea of like where the client is in terms of their safety, how many coping skills they're actually doing or have recognition of, what they would like to focus on. And when you get to that checkout portion of the session, then you already have some ideas on what safe coping skill they might be willing to try over the next week. You can always refer back to it. Hey, I remember last week you said you wanted to try this one. Maybe you want to give it a shot this following week. You can use the information as well as the client. And again, I kind of came up with that one day in session with clients to really reiterate that strengths base because they are walking in the door with a lot of strengths. Some questions that you might want to consider for this topic in reflection with the client is what safety means to them. Why do you think staying safe is essential to your mental well-being? So bringing it back to why is it important to stay safe? And then asking them, how can you develop a consistent safe coping practice? So the idea is just because we're going over safety today in session doesn't mean like, forget about it when you leave here. I want to actually see you implement some changes in your life. What might this look like for you? And then what would it look like to prioritize staying safe? And that includes staying safe from people, places, and things. So just really bringing it back to how is the client going to stay safe outside of sessions? All right, so topic number 2, detaching from emotional pain, otherwise known as grounding. So what does this treatment topic consist of? The purpose of this treatment topic is to learn about grounding, so actually giving the client a tool to utilize to help them shift attention to the outside world and away from the inner world of negative feelings. So in the handouts for grounding, you're going to get an introduction to grounding, different methods of practicing 3 types of grounding. So seeking safety, when it comes to grounding, they teach the client about mental grounding, physical grounding, and soothing grounding. And then the handouts give them ideas of what types of activities fall into each one of those categories. They're going to give you, the clinician, a 10-minute script of an in-session grounding demonstration. So you'll actually get to walk the client through what grounding is. So why should the patient prioritize this topic? Again, this is a behavioral tool for the client to use. It's a basic and simple method. You just walk them through like, hey, this is what mental grounding looks like. This is what physical grounding looks like. This is what soothing grounding looks like. And the thing about this is that it teaches the client how they can themselves self-regulate, how they can reduce their emotional pain or triggers that might be coming up. And the beauty behind grounding is that it can be done anytime, anywhere, and nobody has to know that the client is practicing grounding. It's something that they can be doing for themselves. So really just empowering them that they have the ability to self-regulate. So some interventions to keep in mind when going over grounding with your client. Have the client identify grounding exercises that they enjoy versus don't enjoy. So our clients are, all different. They come from all different walks of life. And some people might really like the mental stuff. Some people might really like the soothing stuff. So I'd say, focus more on the ones that they're actually going to enjoy and see themselves doing in session. So having that conversation to assess with the client what they enjoy versus don't enjoy. You're going to want to engage them in that in-session grounding exercise demonstration so that they can get a feel for what grounding looks like and ask you any kind of follow-up questions like, is it supposed to feel like this? Or this is what came up for me. And so it just provides that space to go over those things. And then facilitate a reflection discussion on the grounding exercise. What came up for the client as they were doing grounding? I know in my experience, some clients have been like, I did not like that at all. That was too much for me. So you're going to really have to assess, depending on where your client is at, whether grounding is something that they're ready for. Maybe you want to focus on other topics before you get here, but just really, having that discussion on, how they felt and what came up for them during the grounding exercise. A majority of clients really love this because it helps them to detach from that emotional pain and it shows them, oh, I don't have to be controlled by something that I might be triggered by. And while grounding might not completely eliminate the trigger, what it does is it reduces the intensity of what they might be dealing with. So just really encouraging the client. I might not be able to take away that trigger, but I can definitely show you how to reduce the intensity of it. Some questions to consider are which grounding techniques do you think may work best for you? So asking the client again, assessing which ones you like. Why might it be important to distance yourself from emotional pain? So we know when people stay in emotional pain too long, they're going to want to cope with drinking alcohol or maybe engaging in a negative behavior or running back to a destructive relationship. So you really want to bring it back and have the client recognize this is why it might be important for me to ground so that I don't have to cope negatively. Then you want to ask them how they see themselves implementing grounding in their daily practice. What might it look like for you to do grounding every day? Is it something you can do in the morning when you wake up, during your lunch break, in the evening? Really getting them to buy into implementing grounding into their daily practice. And then last but not least, tying it back to that strengths base, are there any grounding techniques that you would like to add to this list? So really encouraging the client to buy in. Hey, I noticed this wasn't on the list, but I really like doing this. And then it gives them the opportunity to do something that they like that is also related to grounding. Okay, so last but not least, setting boundaries in relationships. I think all of us would probably benefit from learning a little bit more about setting boundaries in relationships. So something to consider. So what does this consist of, this treatment topic? So there's going to be a review of boundaries in relationships and ways to set healthy boundaries. So in these handouts that you're going to get to go over with the client, it's going to help the client identify, they're going to get a list of what healthy boundaries look like and what unhealthy boundaries look like so that they could really see clear cut what the difference is between the two. Some of our clients have difficulty saying no, given their substance use experiences or their trauma experiences or their life experiences in general. So there's going to be a handout that actually teaches clients who have difficulty saying no in relationships. This is how you might work on saying no or establishing those boundaries. Then you're going to get the complete opposite for those clients who have difficulty saying yes in relationships. Sometimes when we're exposed to trauma or substance use, we can become very defensive, very closed off, that we say no to any and everything. So these handouts are going to come in handy for those clients who don't like to let people in or who have those walls up. You're going to be able to implement a discussion with them on how to explore saying yes in relationships and what that might look like. You're going to give them an opportunity to evaluate any current destructive relationships that they have in their lives and what challenges might come with setting boundaries as a result of trauma and substance use. So this is one of those treatment topics that I think come with five handouts, and you're going to want to break this down too. As you can imagine, this is a lot of information to throw at one of our clients. So just really taking any one of those handouts and making that the focus of the treatment session. Something I've done with this treatment topic is I've carried it over like 3 to 4 sessions as well, just to really make sure that the client has an understanding of what boundaries and relationships are. Why should the patient prioritize this treatment topic? Well, they can learn how experiences with substance use and or trauma have shaped their relationships or boundary setting. They can identify ways to become more assertive in their relationships and also identify ways to distance themselves from destructive relationships. So some interventions, having the patient identify what boundaries mean to them. So as I mentioned earlier, some of our clients maybe have never even heard about boundaries, don't even know what they are. You're doing an assessment here. What do they know about boundaries? And then you can kind of guide the session from there. You want to really implement role playing with this topic. That way, the client gets practice in what it looks like to set boundaries with people. And doing those role playing exercises, you also have the opportunity to process any potential obstacles that may arise with boundary setting. So the client might be really good with you in session because you're really safe. You've provided this safe and comfortable space, but you also want to provide them with some obstacles or some things that they might perceive might come up in setting a boundary with a more difficult or unsafe person for them. Have the patient identify something specific from the handout that they see themselves implementing for boundary setting. So the handouts really go over lots of different types of ways to set boundaries. Again, depending on what population our client is coming from, what experiences they have, cultural considerations, right? Some things in some cultures might be okay versus others. So really just asking and assessing with the client, what do you see yourself doing when it comes to setting a boundary? And some questions to consider for this topic is, how can setting boundaries keep you safe? Again, when in doubt with seeking safety, always bring it back to safety. Why is boundary setting in relationships important? What's an example of a healthy or unhealthy boundary in your current life? And would you like to work on that, or what would it look like to work on that? And then why might substance use or trauma make it difficult to set healthy boundaries? Really allowing the client to talk about their own experience and why that may have gotten in the way of them setting healthy boundaries. I think that's it, except for the checkout, right? So I've provided you guys with an overview today of what seeking safety is, right? So we did an overview of seeking safety. We did that check in at the beginning. We did that quote about why safety is important and priceless. We talked about substance use and trauma and just a quick overview of seeking safety and how to do uh, different types of interventions depending on the treatment topics. So I would love for you guys to share a little bit about one thing that you got out of today's presentation. So this is the checkout that you're going to be doing with the client. Name one thing you got out of today's session. So for those of you willing to share, I'd love to hear one thing that you think you got out of today's presentation. Lots of ideas for discussion questions. This model is more versatile than I realized. It can be beneficial. I'm excited for the handouts. Awesome. So some of you guys got something new out of today's session, which is the goal. I'm hoping when you're out there implementing this with the client, you are checking in with them. Name one thing you got out of today's session, right? And then the second question is, what is your new commitment? So you're going to ask the client, considering everything you've learned today in today's session, what are you going to commit to over the following week? This is where one of those safe coping skills comes into play. Hey, maybe you want to try one of those safe coping skills, right? So my question to you guys, you don't have to share in the chat box, but oh, somebody shared. Thank you. My commitment is to create a proposal to management to implement the program. That is awesome. I love that. I was going to encourage you guys, for those of you who are attending who do see clients, thinking about that new commitment that you would make as a clinician. My hope is that you have more comfortability with using seeking safety with your clients. I know it can seem a little daunting because it's a lot of information, but again, if you approach it in breaking it down in a way where you get the client to relate and you feel comfortable with it, I think becomes more smooth in implementing the process. And number 3 is, again, that case management question. What community resource will you call? So you're always going to be assessing with the client, okay, how are they connected to these other systems that they have? going on in their lives. And so I want to encourage you guys, because I know during this pandemic, some of those community resources that you might have may or may not be in place. So I hope that you get some inspiration today to maybe connect with a new community resource that you can hopefully share with your clients. So, yeah, I think that's it. Thank you.
All right, perfect. Gloria, thank you so much for an awesome presentation. I see folks making some really, really great commitments. At this time, we're going to open it up for questions and discussions. I do have a couple questions that I was tracking throughout, so I'll start with
Okay.
those. And while I'm doing that, folks, please add things to the chat box, and we'll just like bring them in. So, Gloria, someone mentioned that they received training in seeking safety, but their agency never implemented. Someone
Oh,
mentioned that they wanted to like advocate for seeking safety to be implemented at their peer support centers. So, can you speak to maybe what are some benefits um, of implementing seeking safety? What are some benefits to the crisis care continuum, justice diversion programs, or just some information these folks can take to assist them with advocating for that?
definitely. So I love that people are already thinking about that. Like, how can I bring this back to my agency and encourage us to implement this for the client? So, as you saw today, seeking safety is so versatile. It can be used in one session, it can be used in many sessions. So, I know there's lots of different folks here from different counties, different agencies. So, depending on how things are done at your agency, I would just bring it back and just say, hey, so I learned in the seeking safety training that it's beneficial, depending, no matter where the client is. You can be, depending on where they're at on that crisis care continuum, right? Like, no matter where they're at, this is going to be beneficial to them, because we can focus on, something cognitive based, we can focus on something behavioral based. It's really going to depend on how your agency responds to what the client's needs are. And so you guys, as the clinicians or the frontline staff, like, you're going to know
Mm.
more, right, about what your clients can benefit from. So I would say, just really taking it back and having a conversation on how people don't need to be officially certified to do this training. You just, if somebody can invest in having, you just need one manual. And if you guys have a copy machine, then hey, you can go to town with the copy machine. There's no copyright issues in doing copyright copying of the manuals. I know in agencies that I've worked at, that's exactly what we've done. They've bought like a couple manuals and then people have just shared. So it really comes down to investing in the manual and showing your management team like, hey, this is going to be beneficial. We can even run a group on this. And it doesn't even matter where the client is with their substance use or with their trauma. It is easy to implement this in both a group setting, individual setting. Doesn't matter the population. As long as they're adolescent or older, it is an effective model.
Low sounds like low cost, high reward.
Exactly.
Thank you,
Yeah.
Gloria.
Yeah.
Um, let's see. So someone asked earlier, why is it that co-occurring diagnosis of PTSD and substance use disorder is higher in women than in men? Do you have any thoughts on that?
That's a great question. And I wondered that myself. And I think part of the reason is women tend to seek mental health treatment a lot more openly than men do in our society.
Mm,
So I think
mm.
that those numbers are a lot higher because we're seeing a higher prevalence of women seeking mental health services. That would be one of my definite hypotheses is that. The other piece too is thinking about the types of experiences that women might have in society in relation to men, right? Like, not to make it a gender thing, but I think it depends on where, cultural norms, like how you grew up or what you're exposed to and whatnot, but something to consider.
So I'm gonna kind of combine a couple people asked about this. What are some ideas for facilitating seeking safety group process, such peer support for online group sessions, and can this be facilitated virtually? Are there
Oh,
any
absolutely.
modifications you might make, or how would you do it virtually?
Virtually, I would definitely put, so if you can virtually, I know at Kaiser, for example, I run a couple virtual groups and we can screen share. So I would recommend if somebody purchases a manual, let's say you scan what you're going to use, screen sharing when it comes to the check-in questions, so everybody has a moment to check in. And then also too with the handouts, showing them what the handouts look like. If you can send the clients a PDF file ahead of time, I know that's something we're able to do at Kaiser with Protected PHI. We're
Good
able
idea.
to send our clients, the handouts for this week look like XYZ, have them in session. And just, as long as you can screen share, I think it definitely is something you can implement virtually.
Have you heard of a Seeking Safety Facilitator Support Group for ongoing learning?
So I haven't necessarily. Something that I did come across. If you guys Google like Seeking Safety website, there is a whole website with all kinds of resources related to seeking safety. Like if you're interested in becoming a facilitator or presenter, things like that, they have the breakdowns there. There's all kinds of
Oh,
updated resources on the studies that they're doing still with different populations in seeking safety. You can purchase the manual there. So yeah, there's a general seeking safety website where you can get all kinds of information related to seeking safety.
and there, here you have our website and where you can find our newsletter. So I want to thank you again. Thank you everyone who took the time today to join us for this webinar. Gloria, I don't know if you saw the chat box. Impressive presentation. Thanks for some folks that was very informative and really simplifying the material. So appreciate you as well. I hope
Mhm.
everyone takes a second to hit up to go to the survey to give us that feedback. If you have any questions, we'll take them in the chat box. Otherwise, have a great day, everyone, and thanks for joining us.
Yeah, thank you. Take care.